Greetings, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder and one of the board approved CE instructors here, teaching advanced deep tissue massage, medical massage, myofascial release, and more. Now, we are a continuing education provider, which means we train people who have already graduated from rudimentary training in healthcare practices, such as massage, nursing, physical therapy, occupational therapy, and more. If you take our training and need CE credit, please check with your board to make sure they do accept our CE hours before registering in any of our paid training to earn CE credit. Right now, what I'd like to show you is some advanced deep tissue work, which I'm going to do dry on a client's chest. It's a male client's chest, and he has hair on his chest. So you need to be careful that you're not pulling on the hair sometimes. And the techniques that I'm going to do are a lot of pressure without pulling on the client's hair, working that pectoral wall. Now, you would only practice this on somebody who's healthy. Okay, this is pretty advanced, significant pressure. And again, you shouldn't be trying to practice deep tissue techniques unless you're a licensed healthcare provider. And we also do not recommend trying to learn and practice this from YouTube. We recommend registering in some of our training where we can watch you and provide feedback about your hands-on application or give you greater instruction than what we're going to provide right now with this hands-on demo. This is what our training looks like if you're interested in registering for training at our school for advanced deeper work. I'm going to come in here, and this is kind of like a warm-up into applying deeper and greater pressure. Notice how I'm kneading with my first knuckles, alternating back and forth. There are multiple bony landmarks you have to avoid here. I'm going to put it on pause for a second. You want to avoid the clavicle. You want to avoid the sternum. Okay. And you need to avoid the head of the humerus as well. Now, I started off with this kneading compression of the pectoral muscles, mostly pectoralis major, but I am up here in minor as well. Back and forth. And I'm pushing posteriorly and inferiorly at the same time. It's like a 45-degree angle of down and away. I'm also pushing a little bit laterally because most of us Americans have anteriorly rotated shoulders, right? As a matter of fact, show me someone who doesn't have anteriorly rotated shoulders with that neck forward posture that's causing all the pain in the back and the headaches and so forth. So this is a great technique for all of those clients. Now, after I do the alternating kneading of the pectoral muscles, I'm going to lead in here with my ulna and with a dull elbow. So my arm is flexed. The elbow is flexed to make the elbow a little bit dull. If you want to make a sharp, pointy elbow, you would do a full flexion of your elbow. We're going to do about a 90-degree flexion to create a dull elbow here, right? And we're also going to use our ulna. We're almost going to windshield wiper into the pectoralis muscle to give that really nice big stretch. Ready? Here it is. So we're stretching in, and you can hold that too if you feel there's resistance. Pushing in, the client's talking away, he's loving it. We're practicing during COVID outside, which is why he's wearing a mask here, and so am I. You can see I've got a little bit of elbow engagement here, plus my ulna. I'm pushing inferiorly, posteriorly, and twisting all at the same time. Be careful of the head of the humerus right there. Okay. And I felt something, so I'm holding it a little bit longer. You can hold like 30, 60 seconds with some of those holds to stretch the muscle and the myofascia. Now I'm giving a little bit of jostling compression. And I'll play that again for you. So this is simultaneous instead of alternating. Really giving some nice compression. And from here, I'm probably going to apply lotion and go into some deeper work, some more advanced work, some more specific work into the chest in our advanced training. So we hope you enjoyed that. You can find our training here at ceinstitute.com. We have advanced courses, deep tissue courses, myofascial courses, trigger point courses that would all build upon that advanced work. So we hope you enjoyed. And until we see you in another training, be safe.